We are excited to present to you another one of Catch's Lunch and Learn events when once a week therapy isn't enough. And this is a topic that we as the Education Committee have talked about for a while and keeps coming up as something that people are really interested in getting more information about. I think it can be a very challenging world to navigate when you know your child needs support and you're just not sure how much or where or who to turn to. So thanks for being with us today. I'm going to introduce our speaker in a moment, but I just wanted to share that we are going to spend about the first 30 minutes or so doing the presentation itself, and then we're going to leave the second half for questions and answers. So without further ado, I'd like to introduce to you Josh Novick, a great friend and colleague of mine who has been a Catch volunteer for a long time. And he is a licensed clinical professional counselor who is currently doing a lot of consultation work out of his own business that he has started, Trust and Grow. So thanks for being here, Josh. We're excited to have you.
Thank you so much for having me, Lisa. I'm really glad to be able to be with you all and be here presenting on what is such an important topic. We've heard the calls loud and clear that this is definitely something we need to discuss. So I am here. I'm ready to get chatting about it. Basically, my hope today is that you leave with clarity, confidence, and compassion for your child and for yourself, as you may or may be navigating some of the next steps when once a week therapy is not enough. So I'm going to go ahead and dive in. Like Lisa said, we have probably about a half hour of presentation, and then we'll save some time for questions and answers. I just want to share right up at the top that I am happy to share the PowerPoint slides. So if I'm moving too quickly, just hold on and I will get you that information after the Lunch and Learn has concluded. But let's go ahead and get started. And so what I hope we will all walk away with today is how to know when your child needs support, what are the different levels of care, and how do we advocate and navigate those next steps with confidence. If we can cover a couple of those things, I'll feel pretty good about how we did today. All right, so I know there's a few of us on here, and I would love to ask, what comes to your mind, if you're comfortable putting in the chat, what comes to your mind when you hear the phrase higher levels of care? Partial hospitalization, residential, IOP, worry. Yep. All right. We're all in the same ballpark here. Thank you for doing that. I just wanted to show you to go through that exercise just to see where our participants were at as we go through this.
We've got a few additional crisis and the pit of despair, which feels so relevant here. Yep.
Very relevant. Yes. Well, thank you for adding those, Lisa. I just want to say, first and foremost, that you are not alone. If you are in this boat, if you are dealing with some of these issues, you are certainly not alone. While it may feel that way at times, there are many families that are facing similar or exact crossroads, and it absolutely does not mean that you have failed as a parent. We have seen lots of children and teens go through higher levels of care and flourish in their lifetime. And so having these conversations does not mean that you failed or not been successful in any way, shape, or form as a parent. I also want to acknowledge that this system is really complex and parents aren't expected to know it all. I have been in this field for a number of years. I make recommendations to PHPs and IOPs. I'm sitting in front of you giving this presentation. I still get confused and stuck in some of the nuances and technicalities that the system of mental health and higher levels of care can give us. So I just want to really validate that this system is complex and confusing. And ultimately, the goal is not adding more labels, but adding more support. And so that's why I have the quote at the bottom. It's not about giving up, right? If we're moving on past once a week therapy, we're not giving up on anything. We are stepping up support. And I just want to take a pause really quick right now and just to mention that everything we're going to be talking about today is not crisis related. I want to be really clear that if you and your child or teenager are experiencing something that's life-threatening or can be threatening the safety of anyone, that is something that we would consider a crisis, and we would be going straight to an emergency room or a crisis care. So I just want to be very clear from the top that nothing what I am sharing with you today should be in substitution for any crisis support should your family be in that boat. All right. There are 1,000 different ways to recognize when once a week isn't enough. I could have put 100 different symptoms here. But really, what I would think of as a parent that are the three most salient points when recognizing when once a week is not enough is progress has stalled or symptoms worsen. So you have your teenager or your child in weekly outpatient therapy. Perhaps things were getting better. Now we're looking at a situation where progress has stalled, or perhaps even the reasons that that student was originally enrolled in therapy, now those symptoms are actually getting worse. That's certainly going to be one of those major indicators that we're going to have to pause, and once a week may not be enough. The second is the functioning at school or home is declining, right? When we think about the continuum of functioning, you know your child best, you know what's appropriate, you know what's out of the ordinary. And so when you see a marked decline in functioning, whether that be at school or at home, that can also be one of the big indicators that recognize that once a week therapy, outpatient therapy, might not be enough. And then lastly, I have up here therapist recommendation. And you may be thinking, well, if the therapist recommends it, isn't that a pretty obvious sign that once a week isn't enough? And maybe, but I put it up there because if your therapist or your provider has recommended it, I implore you to take that recommendation seriously. Mental health providers and pediatricians do not make those recommendations lightly. So if that recommendation has been brought to your attention, I would encourage you to take it as seriously as the recommendation was brought and to seriously consider it. And if you leave here with one thing, I really want you to think of the additional higher levels of care as like medical care. If your symptoms persist, you're going to seek a specialist, or if your pain gets worse, you're going to go to the higher level of care. And it's the same way with mental health. If the outpatient once a week isn't working and you can start recognizing these signs, then we're going to seek out a specialist or a higher level of support. Really quick, I love this visual. This is the continuum of our mental health levels of care. This is the step ladder. You start off on the left with outpatient. If outpatient isn't enough, then we would progress to an intensive outpatient program. If that isn't enough, we could move a student to partial hospitalization program. If they need even more support, we can move to residential treatment. And then the highest level of support is inpatient hospitalization. And that is just a very brief overview. I'm going to go into what some of these mean a little bit more in depth now. And actually, this was a great time to pause and refresh for a second, because what I didn't say was how cyclical this is in nature. So it's not linear. We can start at outpatient therapy and we can jump to PHP. We can move from PHP down to IOP, right? There's a lot of different variables that exist within this continuum. First, I want to talk a little bit about outpatient therapy. This is what most people think of when we think about therapy in its traditional sense. For the most part, we're thinking about weekly 50-minute sessions with a social worker, counselor, psychologist, someone who's providing mental health support, focusing on coping skills and support. In this environment, the individual is still maintaining independent living at home. Certainly, they are still able to attend school, attend work. This is ideal for our mild to moderate needs, and this is our least intensive level of care. And I also want to take a second and just name that this is an outpatient therapy does not only refer to one-on-one weekly 50-minute sessions. This is also where we would find some of the group counseling offerings or some of the family therapy counseling offerings that are available to our community. And so there is more to outpatient therapy than that one-on-one, your child in front of the therapist. Just something to think about. If outpatient therapy is not functioning in the way that we are hoping it is, and we need a little bit more support for our students, the next thing that we have, the next program that we have on the step up is an intensive outpatient program, often referred to as an IOP. These vary pretty, they vary quite a bit from program to program, but in essence, they are all part-time. They are all 3 to 5 days per week. Many of them are 3 to 4 hours per day. It does provide a higher level of structure. Your child would be involved in group counseling. They would be involved in a number of different kinds of counseling activities as part of the IOP that would expose them to different coping skills and strategies that they would be able to use when they step down out of IOP. The important thing to recognize about IOP programs is some normal routines may still persist. So for example, there are many students that attend an IOP and also continue to attend school part-time. For an IOP, we're really going to be focusing on stabilization and skill building in order to step down that individual back to where outpatient therapy is an appropriate level of care. If IOP is not an appropriate level of care and our student or child needs a little bit more support, the next place we would look to is a partial hospitalization program. And this is a little bit of a misnomer because many of these programs do not take place inside of a hospital. And so I want to name that because sometimes the name can be a little frightening here. Partial hospitalization program, otherwise known as PHP, often are 5 days a week. They are significantly longer in time, 4 to 6. I've even seen longer than that hours per day. Your student is going to be receiving hospital level clinical intensity. So by that I mean group counseling, individual counseling. There most likely will be psychiatry assessments. There's going to be a family therapy piece. There's going to be a real clinical intensity that is stepped up to support your student and your family. However, there are no overnight stays. So I just really want to pause for a moment and just make sure that everyone hears that, in that a PHP or a partial hospitalization program, your child would be in the program 5 days per week, multiple hours per day, basically like a full-time position. However, they are going to be returning back home after the program is over and will be staying with you in the evenings to then return to the program in the morning. Students and children in PHP programs, the focus is on, again, stabilization, safety, structure, increasing that coping capacity before returning to school or stepping down to IOP. If your student is in a partial hospitalization program and we are not seeing the results, there's an additional level of support. There is residential, which is very similar to PHP. However, the main difference, and it is a significant difference, is that in residential, you actually live your student lives on site for a set period. Typically as short as 4 weeks, typically as long as 12 weeks. This is where staff are present around the clock, lots of different practitioners to provide structure, safety, and consistency. I want to name that not all residential programs take place within a hospital. There are residential programs that are housed within hospitals, but there's also many residential programs that are set up to feel more like dormitories, and less like hospitals. And so that's just something to think about if your family is having the residential conversation. Okay, how to know what's right for your child. You're really going to want to take a good look at the functioning of your child, where they are at as far as regards to safety and what the support network looks like. That is really going to be what is a huge factor in the success of these programs, right? We know that these programs are all, whether regardless of level, are going to provide some supports and strategies. And so we want to consider what is the functioning and how can we support our child through this process. Certainly, you're going to want to talk to your current therapist and or pediatrician. They will give you recommendations. You can almost all programs have a program intake team or person that is tasked for providing assessments. And so you can reach out to some of these organizations and they will take some information from you about you and your child and the situation. And then they will make a professional recommendation. And one of the things I always like to pose to parents when we're in this conversation is really try to think about what will success look like in 4 to 6 weeks, because that's really a good space for thinking about what kind of changes we can see and we'll be able to revisit in 4 to 6 weeks and know that our program is meeting the needs of our student, of our child, and our family, or it's not meeting the needs of our family and we need to increase it. And certainly we don't want to be waiting longer than 4 to 6 weeks because this is something that we want to continue to be assessing. All right. So now let's say your family is having a conversation about entering into one of these higher levels of care, or perhaps you are coming down from a crisis situation and a hospital has recommended one of these levels of care. There are some common challenges and ways to move forward. The number one common challenge that our students and families run into is the stigma. Even in this day and age, there is still a significant stigma that exists around higher levels of care. We see that throughout all across age groups. We see that all across socioeconomics. We as mental health professionals are trying our best to decrease that stigma. However, I just want to name that still exists. There is still shame associated with some of this. And while I don't think there should be, I just want to name that there often is. And so that is absolutely a challenge to navigate. And that stigma not only exists for our children, it also exists for us. And so that is a multi-layered sense of stigma that we need to break through. The next biggest common challenge that we hear when talking about a student or a family, engaging in these conversations is the disruption to school and activities. Hands down, one of the biggest things we hear is, well, if my student enrolls in an IOP or a PHP, they're going to fall behind in school. They're going to miss, important things. They're going to miss out on their activities, the things that bring them joy. And so that is another extremely common challenge that we run into. And we'll talk about how to deal with that in a second. Some of the other issues that families often run into are more logistical costs, logistical in nature, cost, insurance, finding a program, right? Those are all the nuts and bolts of getting enrolled in a program that can cause stumbling blocks. And so first, I want to address that stigma piece. I really would encourage anyone having any of these conversations to really come to the conversation as we are adding support. This is not a sense of failure. This is not a punishment. We are adding support like we would for any medical condition. We would simply continue to escalate support until we found that right level of support. And so I think it's really important for us as parents to frame it in that way. And I think that's a really great way of the trickle down, we can eliminate the stigma. With disruption to school and activities, I would encourage you to work and partner with the school as an ally. So there are different situations that can arise as you work with the school. There are different programs, there are different opportunities, there are different options. Every school is a little bit unique. And so my charge to parents would be, as much as possible, to try to use the school as an ally. And also recognize that there may be disruption to school and activities if no action is taken. So often we think about the common challenges to an IOP or a PHP as the disruption to school. We don't want our child to fall behind. We don't want them to miss out on their sport. We don't want them to do any of these things. And that is all completely valid and makes perfect sense. However, I will also share with you, there may be a potential that there's going to be disruption to school and activities if we don't add the support and the symptoms keep progressing. Just something to think about. And then lastly, with some of the logistics piece, I recommend communicating with your health insurance provider. They are ultimately, often, for many of our families, the people who are going to be providing the financial support to make these programs possible. And so you're going to want to work within your insurance provider's parameters to ensure that you are working with a program that is covered, if that's what you're looking for, and meets all of your needs. How to advocate effectively. This is going to seem pretty simple, but I think it's just important basics to think about when we are entering into any of these spaces. These conversations are hard. They are challenging. They take us out of our window of tolerance, which I can explain a little bit more in the questions and answer section. But they're hard. And these conversations are hard for our students and our children, but they're also hard for us. And so some of the strategies that I give to parents is prepare questions ahead of time. Of course, we know that there's going to be some improv and some things are going to come up as you have conversations with providers. But the more that you can prepare questions ahead of time, the more prepared you will be and less likely to hang up the call and think, oh, I wish I had asked them this, that, and this. Try to take notes. Again, that's not always the easiest task, but try to take notes as much as possible, because in many of these calls and in these appointments, there is a lot of information that often can be conveyed. And so the more notes that you are able to take, hopefully the better communication you'll be able to establish right from the beginning. Along those same lines, ask questions, right? You are your child's biggest advocate in this way, to ask questions, to really question the process and make sure that what actions you are taking are most appropriate for your child at that moment in time. And then lastly, and I've said this before and I will continue to say it again, recognize and understand that this is a frustrating process. So cut yourself some slack, try to give yourself some grace, as challenging as that may be while walking through this. Okay, I have some last couple things that I want to start wrapping up with. And so when thinking about making the best decision for your family, I really want to share with you, there is no perfect path. There is no ideal path. There is no one path that fits all. The perfect path is the one that works for your child and that works for your family. Only you and your child are going to be able to accurately navigate that. And so you can certainly learn from others. You can see what others have done in similar situations. And I want to encourage you to remember that there is no perfection. The only path that is perfect is one that's meeting your child and your family's needs. Secondly, progress is not linear. This is something that your provider will probably share with you, but I want to just hammer it home again, that healing takes time. And sometimes we actually see some symptoms worsen before we see them improve. And when I say that it's not linear, some days we may see the symptoms significantly improve. The next day, we may see symptoms getting worse again. And that might be over the course of weeks and months. We are human beings. We don't have the same level of capacity every single day. And so what progress looks like isn't the same every single day. And then one of the most important things to remember is that you can revisit and step down levels as stability improves. None of these programs are signed in stone and written in contracts that you will guaranteed to be in this program for X amount of time and you'll be guaranteed to be in this program for X amount of time. Every IOP and PHP that I've had the pleasure of working with has been collaborative with the family and the student to revisit the level of need. And the ultimate goal, regardless of program, is to increase stability and step down the level of support. Lastly, I just want to name that there are some really great resources available to us in our community. There is the NAMI Metro Suburban website, has a fantastic depository of Chicagoland treatment programs that they are pretty consistently updating. I would also highly encourage you to visit the Catch website and explore our resources that are available through Catch. If you are having some of these conversations or you think you're moving towards some of these conversations. And then there are also some more systems that you can use to help find treatment. So while the NAMI Metro Suburban is great for our immediate area, SAMHSA, SAMHSA, has a treatment locator that is national. And so that may be able or useful for you if you are thinking about different geographical areas away from the North Shore. And then lastly, many people are familiar with Psychology Today for their individual, finding an individual counselor or therapist or psychologist. They also have treatment centers available on psychologytoday.com. And so I share those with you to tell you there are a number of different places that we can go for support and for lists of treatment facilities. And lastly, before we get into the questions, I just wanted to share my email and my social media handle. I would love to follow up if you have any continuing questions. Like I said, this is a very confusing and nuanced subject. So please feel free to reach out if anything comes up after this session. And I am going to ask my wonderful co-host, Lisa. First, how are we doing on time?
Doing great on time, Josh. You nailed it.
Awesome. Perfect. Thank you. And then my follow-up question is, did we receive any questions via chat, email, however they were coming?
Yes, we did. We received a few. All right. One question that came in is, can you recommend any tactics that parents and therapists can use to make the child feel like they are truly part of the decision-making process when you're exploring these different levels of care?
Yes, absolutely. A phenomenal question. Thank you to whomever asked that. I think this is certainly going to be age dependent and maturity and cognitive development dependent. However, I think the more that we can invite our child into these conversations, the better off. I think sometimes there is a tendency for us parents to protect and try to insulate our young people from some of these medical and clinical conversations. And my encouragement is if you feel that your child, teenager, is of a point where they can hear some of these conversations, I would encourage you to bring your student or child into some of these meetings. And to that point, I would also encourage you to work collaboratively with your student or child while looking through perhaps you're looking at the NAMI Metro Suburban list, or you're on the Catch website looking for different resources. I would highly encourage you at that early intervention stage to also include your child and ask what it is that they're looking for. Some of the same questions I ask you can be posed to your child. Like, what would success look like in 4 to 6 weeks? Right? Some of those similar tenets that are being asked of you, depending on the age of our child, we can go back and really bring them in a direct way. For younger students and children, I would encourage you to be as transparent as possible. I would encourage you to provide facts and validate whenever those opportunities arise, while recognizing that there is going to be some ambiguity and some challenges when starting one of these programs and having your student feel like they have some ownership at a younger age.
I love it. You mentioned that question to ask, what will success look like in 4 to 6 weeks, to have, parents thinking about that, to have the student thinking about that. I paused on that when I saw it in your presentation, and I wondered, what should we be expecting in 4 to 6 weeks? We're talking about needing higher levels of care because there's a lot that needs to be addressed and students are really struggling. How much should we expect will change in that time frame?
That's a really, really great question. And I will share that, like with most similar medical issues, the more severe our symptoms, the longer the length of treatment often is necessary to come back to a previous level of functioning. That being said, I think it's a really challenging question to answer because so many of our children and families are entering this for such varied reasons. But let me give an example,
Please.
and I think that may help. So I'm going to use one of the easiest examples to talk through in my mind, and that's addiction. If you have a teenager who's experiencing an active addiction, I'm imagining if you are talking about what success would look like in 4 to 6 weeks, you are probably talking about the cessation of that addiction or a significant harm reduction in using of that addictive substance or whatever that addiction is. And so, for example, if you're in an IOP or a PHP for addictive behaviors, the way that you're going to see success is measured in how are those addictive behaviors showing up? Is your teen or child still using those substances or outlets? Are they using it less frequently? Are they having more coping strategies so that it's not an issue at all anymore, right? However, I will say that is not the likely outcome. When we're talking about higher levels of care, I think it's really important to not go in expecting perfection and not go in expecting a complete return to what your child or teenager was like before this process quickly. We know with mental health and with just child development, some of these, they change the way that our students look at the world and look at the way, they see themselves. And so I would encourage you to continually to assess and ask your student what success also looks and feels like for them.
I guess to that end, maybe my next question is around what we should expect by way of the depth of the work that could be done. I know a lot of these programs, they really specialize and emphasize in the tool building, coping strategies for managing tough situations in day-to-day life and using a lot of CBT and DBT tools to do that. Is there also work that's done on the deeper, get to the heart and the root of the issue that's causing the anxiety, the depression? That's the root, the underlying cause. Or is that not really what these programs are designed for? And that work needs to then happen elsewhere once you're equipped enough to return to your everyday life?
Great question. And it's definitely going to be dependent on what our initial issue is or what our symptoms and what our diagnosis is. And it's also going to be dependent upon those particular treatment programs. And so I will share with you, they all have some basic tenets. However, especially in the North Shore, we have seen that there are some programs that lean much more heavily into a purely skills-based program where your child or your student is really engaging in more classroom-like strategies to exactly what you said, Lisa. Learn the CBT and the DBT to prevent the symptoms from arising. Then there are also programs that, in addition to that, are also providing different levels of support to help get at the underlying issues. And so there are some programs that have some more process group, that have some more family therapy components. They may have psychiatry components, right? There's going to be a different level of care that you are receiving in some of these programs. And these are the questions that I would encourage you to ask when you are having these conversations. And this right here, this question is really where we want our student, if possible, to be brought into the conversation as much as possible. Because we know from experience that there is a certain personality and a certain child that does really, oh, excuse me one second, that does really well with skills-based and responds very well to that. And there are other students and children that respond very well to a more process-orientated program. And they're not, they're separate, but also similar. And so sometimes what we find is that we see students and children needing both at different times of their development. And so sometimes what we see, quite frankly, is a student who will go to one of the more classroom-like experiences, learn some more of the skills and strategies that we would hope. And then if we are still seeing symptoms down the road or reappear at a later time, perhaps then it might be a different conversation to think about one of those different programs that comes to this work from a different lens.
Makes perfect sense. Somebody asked, if you're looking for residential treatment options, how do you find reputable programs, since there are so many options and some that have been sort of problematic ones?
Yeah, so with residential treatment, you are really going to want to work hand in hand with your pediatrician or your provider, and you're going to want to really meet with that team of that facility. I think, with IOPs and PHPs, the personalization and what you and your family are looking for is incredibly important. But what you are looking for in a residential is even more nuanced, right? We're thinking about living conditions. We're thinking about food. We're thinking about all sorts of different conditions. And so I think those are some of the questions that are really important when exploring residential treatment. And the other thing I would do is, this is not necessarily a isolated incident, or you are not alone, right? If you are able to reach out to different organizations like Catch and work with, community members and your peers, you will more often than not be able to find some recommendations, just like you would for your pediatrician or your ENT. It's going to be the same way for our mental health providers.
Great. Thank you. So far, everything's focused on straight mental health issues. Somebody wants to know, how would this relate to young people with IDD or neurodiversity as well? Do these supports and programs exist for that population?
Yeah, so certainly, phenomenal question. Thank you to whoever wrote that. I really appreciate that. There are absolutely certain programs that are tailored to certain individuals' needs. And so we certainly see that on the North Shore. They are available within the list of providers. And I will say that some of the programs that may not explicitly say work with neurodiverse individual or individuals who identify as neurodiverse, there are often cohorts that exist within these programs. So, for example, we often see at PHPs or IOPs that there are a number of different groups that are operating within that program. And oftentimes, what we see is they put students or children who have similar needs in similar groups. And so, for example, I know that one of the largest providers in Northbrook for PHP has a very strong LGBTQ track. So they have their, when a student or a child enters their program and identifies as LGBTQ, they are enrolled into a particular, they are asked if they would like to enroll into that particular cohort, and then they receive some more information, and their families therefore receive some more information and support related to that identity. I would say it is similar for IDD and for autism and our neurodiverse individuals. I would say that, again, those are some of the really important questions that we need to ask when talking to a treatment team, because that is absolutely going to change how we want our child and our family to receive care. And so thank you. That was a beautiful question, and thank you for the reminder.
What would you say to parents who are just so afraid to let their children enter a higher level of care? It can sort of almost feel counterintuitive to let go when your child is in crisis and hurting so much.
It does. It is counterintuitive. It goes against our DNA to hold our children safe and keep them protected with our bodies. That being said, what I would say is something, if we're having these conversations, something's not working. And while you are an incredible parent for wanting to support your child in that way, amazing. Thank you for being there, for protecting and for advocating for your child. However, just like with a medical issue, if your child, and this is an extreme example, but if your child was to be diagnosed with a disease, you would probably open yourself up. Many people would open themselves up to finding treatment for their child because they know it's something that if they don't seek treatment is going to continue to get worse. We often forget about that with mental health. With mental health and other issues, we sometimes think that if we brush it under the rug, it will improve. And that is unfortunately not often the case. So my encouragement to parents, where the instinct is to hold on as tight as possible, is examine that's great. That has been working for you and your family, but perhaps now there's some additional levels of support. There's other teammates we need to bring in to your circle. You're not giving up control. You're adding teammates to your circle of support. And so that's really the best way that I would frame it to a parent is you're always the parent. No one can take parent away from you. What you can do is you can add in other members of the support team.
Absolutely. I think about shifting the narrative a little bit too, from like, what, you're just going to send me away. You don't love me enough to keep me here. And really doing a reframe of actually, I love you too much to see you struggling in this way. I love you too much to watch this continue for another day. It is because of how much I care about you that I'm even considering these kinds of options.
Yeah, certainly that framing can make all the difference when talking to our children.
And even if you get the parents on board, what do you do if you don't have the child, or let's say in particular a teenager, on board and they are just in refusal mode and they're kicking and screaming and you can't even get them in the car because they're bigger than you are now, or you get them there and they're just silent and refusing to participate? How do you handle that?
Well, those are two different scenarios.
Yeah.
If you're
Both, Josh.
Yes, well, I'm going to work backwards. If your student is attending but is silent and not cooperative, my first piece of advice would be to be patient. That no one, whether an individual is hurting or not, feels comfortable opening up to a group or to other individuals unless they have a felt sense of safety. That does not occur overnight, regardless of our treatment level. We can put you in residential, we can put you in IOP. The chances of you feeling an immediate sense of felt psychological safety is pretty slim. And so my best recommendation to someone who is experiencing that kind of behavior is to be patient and to continue to work with the treatment team, because I promise you, your teenager is not the first silent, sullen teenager to go through the program. I guarantee it. And so therefore, their clinicians are also going to have strategies to help offer to you to help bridge that gap at home, just like a teacher might, if you were working on academic subjects, provide some extra resources. That treatment team may provide those resources. If you are in a more challenging boat where you are really not even able to get your child, teenager, student to the treatment facility, I think this is really where we need to work with our schools and our other people in our support network and call out the bat signal, so to speak. I think this is the opportunity where if you can, to bring in people close to your family, close to your teenager, who are within their sphere of influence, that may be saying similar things to you that may be received entirely different. And so that is really, not to harp on it, but this is really why we want to identify our support system and who we have to assist us in this work. Because sometimes, Lisa, every parent on here knows, you could say something and it's in one ear, one out the other, and then a peer could say the exact same words, and all of a sudden, your teenager has stopped and actually listened to it. So we know that the messaging changes depending on who the messenger is. And so my encouragement then would be to get creative. Who are our other messengers? What other ways can we communicate and reframe, right? That this is not a punishment. This is not something that you are being subjected to. This is not something that you are being tortured into. This is something that we are engaging in as a family, collaboratively, to figure out whatever that success looks like for us as a family and move the needle towards that goal. And so I really think, the more that we can reframe, the more that we can remove stigma, and the more that we can have different voices contributing, the more likely it is that we can get a resistant teenager on board.
Yeah, I appreciate that. And you're talking about the family and the support system and how integral all of that is. I'm curious if you could share a little bit about your understanding of how much the family is involved once a student is in, let's say, a PHP. They're there 9 to 3, Monday to Friday. How much do the parents learn about what skills they're building? How much is family therapy incorporated into the process so that they can continue the work when the kid goes home at the end of the day?
Absolutely. So again, every program is going to differ slightly. And in my experience, every single PHP is going to have some component of family therapy at least once a week. And so what that usually looks like for many of our teenagers is a session with the teenager and the parents and the family therapist who's been a part of the treatment team working with your student in other capacities. Sometimes it's a family therapist who's just brought in for those specific family therapy sessions. But oftentimes there is a bare minimum of a 50-minute family, like what we think of as a family therapy session with all the parties involved. And almost many of our providers, especially in our community, offer other opportunities for parents and loved ones to learn more and be more supportive. So, for example, there are a number of IOPs and PHPs that offer loved one support groups, that offer lots of different groups and opportunities for whether you are a spouse of someone entering these programs, whether you're the parent, whether you're the sibling, right? There are lots of different ways that we think of how these programs can impact the family unit. And so these programs often have ways to help mitigate the ways in which it impacts the family unit and helps the rest of the individuals in the home understand what's going on, be more tolerant, and work within the framework that the student or teenager is learning so that you're all speaking the same language and moving towards, hopefully, the same goal.
For sure. I have one more question here that I wanted to address, and then we'll wrap up unless anybody has any other burning questions to throw into the chat right away. But the other question was just about this school piece. I know you had said that's one of the biggest barriers is this concern about what do you mean I'm going to miss, 4 to 6 weeks or whatever it is of school? How am I ever going to catch up? And sometimes I think the schools can be a little bit difficult with what work you need to make up while you're gone, et cetera. Any advice for helping to navigate that either with your own student or with a school team?
Yeah. So when working with the school team, I think the best thing that you can do is really be transparent about what you and your students' needs are. I think when working with the school team, we often sometimes downplay or minimize some of the needs of our family and our children. And so my encouragement would be to be honest with the school team in with what you are expecting. You may not necessarily receive those supports, but you want to certainly have that conversation, that open and honest conversation with your school-based providers. The other piece that I would share with you as someone who has been a high school counselor for many years, there is this sense of falling behind, of sticking with your peers, of failing, of coming off cycle, all of these things. And the biggest encouragement that I can give to families and therefore students is to try to reframe it and think back to the medical model. And that if, again, you had a student who was diagnosed with a curable disease, but that was going to be in treatment for 6 to 8 weeks, most parents wouldn't bat an eye to think about that treatment because it would save their student's life. I know that's an extreme, and yet it's the reality of the situation. And so I want to encourage parents to think about their students' mental health and needs in a similar way, in that if this is something that is really causing an impact on their daily life and functioning, we are going to see them fall off track, fall behind any number of those worst scenarios anyway. So I would encourage the parent and the family to embrace that sucks, that, here we are, and yet it's a preventative and early intervention matter.
Yeah, I think you're so spot on. I think oftentimes families think about what are they going to miss if they do this, or what are going to be the downsides of this, and there isn't enough consideration but what happens if we don't?
Right.
So yes, well, thank you. I mean, this has been absolutely incredible. You are wonderful and knowledgeable as always, Josh, and we just really appreciate your insights into these different levels of care and how to do our best to navigate them and find the right people in our circle to help us do that when it's too difficult to do alone. So thank you for being here. We so appreciate it.
Well, thank you so much for having me. It was my absolute pleasure. It is always so great to chat with the Catch team and Lisa. So thank you. And like I said, if anybody has any questions, feel free to reach out. I can probably point you in the right direction. And thank you all for tuning in and listening and joining.
And we wanted to share an update that our podcast, Parenting the Mental Health Generation Season 4, is out. So please give it a listen on any of these things where you find your podcasts. And one other initiative you want to flip, there we go. In our mental health awareness campaign, we have our Note Your Feelings campaign, where you will see all around different parts of Northbrook and Glenview in different schools, a campaign for students to be asked to share their feelings on Post-it notes that are then going to be displayed all over the schools. So look for those yard signs and have your family and your students and your children participate. Thank you guys for being here. Take care, everyone. Have a great day.